Sam Smith, stay with me. 105.1 The Buzz. Daria mentioned Ted. We're having some headphone difficulties. We lost a pair.
Dr. Chan took my headphones.
Dr. Chan, only use your own
Dr.
headphones.
Chan took my headphones.
Cosmetic surgeon Dr. James Chan's in the studio with us.
Oh my gosh.
Stealing headphones.
But I will say this about Jimmy C.
Jimmy C.
Your website looks great.
Oh, thank you.
The Reviance Portland spelled out .com. No www. Just Reviance Portland. That's all you have to type in. And the before and after photos are my favorite thing. They're so beautiful. I keep talking like this to Dr. Chan. So I have some questions for you.
Yes.
There's a lot of times you will see. Oh, by the way, if you don't know who he is, Dr. James Chan is a dear boy from the California area.
Double board certified.
He's double board certified. He went to like all the famous schools, and he's super smart, and he's like a genius when it comes to the face. He's also cute as a bug. Like he looks irritatingly young. Are you? You're like 37 or something crazy, right?
No, I'm a little older than that.
A little older than that. But he's an ear, nose, and throat specialist. But he's also an expert in the science of aging, and he's a plastic surgeon. So those factors combined mean that he takes both a pragmatic and medical and artistic aesthetic approach to the face and how it can best look young, stay young, become younger looking, tighter, tauter, more refreshed, better.
Just a better you.
I don't want to single this person out because I'm not sure how she would feel about it. I have to ask her first. But there is a person in particular that has been associated with you for some time, and I've seen sort of some of a process that her looks have gone through, and it's crazy. She now, yes. This person now,
she's like the Joker now.
She now looks like her own daughter. It's like it's crazy. But he's good. He does a lot of great things. So here's my question. When you see certain women of a certain age, especially if they're in the public eye, you sometimes will see that they have a very, very taut, youthful face. And then suddenly, past the jawline, everything seems to have done a rapid age.
Yeah.
It's as if they fixed the face, they made the face look youthful, but they did nothing about the whole neck or décolleté area. Why is that? And is that changing through medical technology?
Yeah, so first of all, that area is an area that's often ignored by a lot of people as they put sunscreen on. They don't protect that area. So when you go out...
Well, they're idiots.
Right. So you tend to get a lot of sun exposure there, and it damages the skin there. And the skin there is not as resilient as it is in the face. It doesn't bounce back as well. It doesn't repair itself as well. So that has limited our treatment options that are available for that area. You know, on the face, you can laser, you can do a lot of things, and the face will recover from it. But in this area, you can't. So for the longest time, we didn't have very many options for repairing that. But now we have several very good options. And by combining things like Ultherapy, which you've tried before on your face, they have a new handpiece that's a little shallower, and you can hit this area with it. Combining that with some of the lasers, the intense pulse light laser, and then using some of the topical creams and ointments, doing all those things can really repair that area, and it does a great job when you combine them all.
And can it be used, does it have to be used repairedly, or can it be done preventively?
So
the best thing you can do preventively is sunscreen, right?
Sunscreen, correct. Yeah. So it will reverse and repair some of the damage that's there. And then once you've repaired it, then it's, on to maintenance. So that's more of the creams and the intense pulse light and stuff like that.
Awesome.
Fascinating.
Awesome. Here's a question with Botox, and this is something
hold
also
on,
that...
I have to follow up to that.
Oh, God.
That doesn't
What?
You can't do
What?
that. Well, what about just wearing, like, the Ricardo
Turtlenecks?
Montalban chest plate to make it look like you've got amazing, smooth skin up there?
Ted, that is your
Rafa
solution
Khan.
for everything.
I know. Chest
What do we
plate.
do about the
The
budget? Chest plate.
Put on a mask.
What do we do
There, now
about
your
the
face
Gaza
looks better.
Strip? Chest plate.
Yeah.
Another question, Base. mainly on celebrity photos. Sometimes you will see a woman who is unusually wrinkle-free for her age. She'll have a smooth forehead. She'll have maybe she's had filler or Botox for laugh lines, whatever else. She looks like not overly done, but just unusually.
You're
wrinkle-free,
Michelle Pfeiffer.
if you will.
Yeah.
But then sometimes you'll see between the forehead and the hairline, just sort of like way up towards the hairline, it starts to gather and wrinkle. What's that? Is that
The brow lift?
improper use of Botox?
Well, it can be a number of things. I mean, if you get a brow lift that's less than ideal, you can get some bunching up in that area, and it shows like you're describing. Sometimes it can be Botox. I mean, Botox, when we use it in the forehead, it's designed to selectively reduce the wrinkles in that whole muscle. But if you don't hit all the areas, and there are some areas by the hairline that we don't usually treat, you can get some bunching up there.
We had a story yesterday about maggots in your scalp. Some woman had maggots in her scalp.
Yeah,
Could
so-
be maggots in their scalp.
It's probably not maggots.
Could be.
It's
Could be.
unlikely that it's maggots. Mitch would like to ask you right now, and I can tell by where he's going with this. Do you ever use leeches in your medical practice?
You probably did medical school.
Yeah, we did. In residency, we did that a lot. In residency, we did what we call free flap transfers, where you you can take your fibula, reconstruct it, and put it where your jaw is. So
What
can
are you
reconstruct
talking
it.
about? Leg face!
Exactly.
The fibula comes from where?
From the leg.
Okay, it's a bone?
Yeah, it's a bone there. So you
bone, it's a
take
leg bone.
straight bone, you break it, and you reconnect the blood vessels up here in the neck. And then sometimes those blood vessels don't work so well, so the tissue gets engorged. So you have to use leeches. That's
That
where
is-
leeches come into.
So at most hospitals, is there a room with the leeches and the maggots?
You order it. The pharmacy orders it, so I think they ship it in from a leech farm.
I should raise
that you
leeches.
snuck maggots in there, Mitch.
Well, because they use maggots to eat infection, correct?
Yeah. It used
All the
to-
time.
Well, we don't really therapeutically use maggots like that, but they do. That's what they do. I mean, they do clean up wounds. So, in medical school, when we're doing rotations, you do see people come in with maggots on their feet and they need them
Intentionally?
amputated. No, these are people who come in, needing their foot amputated.
So the worst thing ever. They're coming into the emergency room with maggots in their wounds.
So those aren't maggots from the pharmacy. Those are maggots from the garbage can.
Correct.
Okay.
By the way, we came up with a theory, and maybe you could back us up since you're backing crazy theories today. Perhaps Daria and I
He's not
think.
backing. He's just giving examples of
Sure.
how they're utilized in
He's
med
backing
school.
Mitch's weird leech theories. I've got it. No, but we think that since the maggots eat necrotic tissue,
Yeah. Zombies?
zombie apocalypse. Why has no one ever thought to end a zombie apocalypse?
Honestly,
with
just fill a
dumping
big pit,
maggots?
fill a big pit with maggots. The zombies
just
will fall
eat the
in.
zombies away.
Maggots eat the
Sure.
zombies.
Do you think that would work in theory?
That would work in
All right.
theory.
And he's a doctor, ladies and gentlemen.
Double board certified.
James Jan.
I wouldn't be surprised if that's not eventually. Have you heard of the little fishies? They're little
Dr.
fishies.
Fish is what they're called.
Really?
Yeah, Dr.
Yeah, they're
Fish.
called Dr. Fish.
You put your feet. You got these nasty, horny, callous, thick-skinned feet.
Mm-hmm.
You put your feet in the little foot pool of fish, and they nibble away at all the dead skin until your feet are smooth and
That would
luxurious like a
feel
baby
so
butt.
good. I would love that.
What if you have like a thick calloused face? Does that ever happen? Do you ever get a thick calloused
You're
face?
getting 8 years of weird theories.
No, and then you
Has a
Like
calloused face.
leathery
This wo-
skin.
Yes.
Yeah.
This woman does. And then
Okay.
she goes, and it's damaged and wrinkled by the sun because of all the callousing and the calluses and the corns
Looks like
on her.
Rutger Hauer.
Corns on her. Shut up about Rutger Hauer. He looks fantastic for his
does look
age.
great.
Like a Clint Eastwood puts his face in the pool, brings it back out.
Here's what I'm
young
trying to
Clint
ask.
Eastwood.
Yes, thank you, Ted.
Yeah.
Face a pool of fish, Clint Eastwood. You're like, come on in, Clint Eastwood. Welcome to Reviance. And he's like, you're like, dip your face in this, my good man, former mayor of that place. And he dips his face in, and he comes out.
He looks 50 years younger.
Seriously, he's
50
like
years
a
younger.
He's the man with no
smooth and
name all over
clean.
again.
Yeah.
Yes, I mean, in theory it would work, but we have better technology than that now.
Way to save it. Brilliant.
I think that should be his tagline.
Yes. It would work in theory, but we have better
For
technology now.
every appearance on the show, Dr. James Chan. You can visit his website, which is awesome. But it's still like no website can come close to the astounding results that he's able to produce. He has walking around this town visual examples of his expertise. drjameschan.com or ReviancePortland.com as well.
Also, just a charming, fun guy to hang out with.
Honestly, you're just going to want to sit and talk to him. Like that in itself is a treasure of an
Can
experience.
you make an appointment? Just come sit and talk. How much does that cost?
I've got some weird medical theories.
And will my insurance cover it?
I bet people do that. Do you ever have people that never? I know you probably won't want to say yes or no.
Never book
but do you
anything?
ever have people that, yes, they just keep coming back for consultation meetings and they never book a procedure?
We've encountered a few of those.
Yep.
Yeah.
Oh, but for the grace of God, Dr. Chan, there I go. 888-733. Oh, no, sorry. No questions.
we don't need any
drjameschan.com or ReviancePortland.com. Thank you very much, Doc, and we'll see you in a couple weeks.
Thank you.
Non-stop.